Hello, this is Dr. David Green, Education Director for Pacific Bay Recovery in San Diego. Today's topic is private drug rehab for dentists. Let's look at the scope of the problem. Over 10,000 people in the U.S. abuse prescription medications for the first time every day. Drug abuse truly knows no socioeconomic boundaries. Both blue and white-collar individuals are susceptible. 10 to 19% of dentists develop a drug or alcohol problem, which is slightly higher than that of the general population. The dental community is not immune to the epidemic of drug abuse and addiction. There are many reasons that dentists might abuse drugs. First and foremost is access. They do have DEA licenses, they are allowed to prescribe, they do have nitrous in the office. The drugs of choice among dentists are alcohol at 37%, opiates or benzos at 31%, nitrous oxide 5%, and then illicit drugs at 10%. Dentists and research have been shown to overall have compulsive personalities, which can predispose to higher levels of addiction. Additionally, stress, such as the financial burden of owning a practice. 76% of dentists have a solo practice, and frequently there's a lot of competition in the community, which can lead to a sense of isolation and financial stress. Also, family problems, which are ubiquitous everywhere. And it's not the typical spiral. In the initial stages, a dentist who is an addiction problem, it does relieve anxiety and fear. They are making enough money to keep up with the addiction by and large, and most feel like, I can handle this, I can beat it myself. When the idea of rehab comes up in their head, initially it's a combination of shame, fear, and denial. In reality, medical professionals are no better equipped to overcome addiction than the rest of the population. Also, dependence eventually turns into a chemical imbalance. It actually changes the brain, and that truly needs professional help. Once that is realized, it helps objectify the problem and makes dentists less ashamed. Treatment can truly be private. Dentists who find themselves mired in addiction can seek confidential treatment for two reasons. One is HIPAA, and the other is records for patients undergoing treatment for substance abuse are protected under Title 42 in the Code of Federal Regulations. Pacific Bay Recovery offers the top private rehab center in San Diego and all of Southern California. There are several steps. There's a lengthy intake process, and then detox, inpatient rehab, and then outpatient recovery. Our private rehab center offers both inpatient and outpatient treatments for the highest success rates, which are over double the national average. You can remain anonymous, and the center takes care of all the arrangements. Call us today at 858-263-9700 and visit us online at pacificbayrecovery.com.